Kia ora koutou katoa and good morning. With vaccination rates moving to and beyond 90% across the country, New Zealand is close to transitioning to the traffic light system and a much greater sense of normality. As we move into the new framework, many people have been seeking greater certainty about workplace vaccination requirements. That's why a few weeks ago I announced that we would introduce a clearer and simplified risk assessment process for employers to follow when deciding whether they can require vaccination for different kinds of work. Today I'm setting out the simple and clear vaccination assessment tool and how it will work. The tool provides a clear legal framework to help businesses and other organisations who employ people make decisions about vaccinations in the workplace. Employers who use it correctly will have a very high degree of legal certainty about their decisions. It builds on the guidance provided by WorkSafe, has had input from Business New Zealand and the Council of Trade Unions, and is based on public health advice. The tool will specify 4 factors, at least 3 of which must be met, before it would be reasonable to require vaccination for particular work. These factors are, firstly, how large is the space that people work in, how close people are to others, how long they are near others, and finally, whether they provide services to people who are vulnerable to Covid-19. This will enable businesses and organisations to do much more easily what many of them are already getting on with. For example, Air New Zealand and the Warehouse, who are currently working through risk assessment processes to determine workplace vaccination requirements. This is also becoming fairly common in countries overseas, for example, the Commonwealth Bank, Qantas, Westpac and News Corp in Australia. I want to be very clear that this new process won't override risk assessments that businesses have already done under existing health and safety guidelines. Businesses can also continue to undertake broader health and safety risk assessments if that works better for them. All health and safety risk assessments will remain valid. Legislation allowing the vaccination assessment tool to be created, as well as introducing a 4 weeks minimum paid notice period of termination and paid time off to get vaccinated, will be passed under urgency in the House this week. The assessment tool will then become available for business to use once regulations are made in mid-December under the amended law. We've also decided to mandate vaccination for workers at businesses where the My Vaccination passes may operate, or operate with fewer restrictions at all levels of the Covid-19 protection framework. We've tested this with stakeholders and it's received broad support, including from religious communities. As a reminder, this mandate, the CVC mandate, applies to hospitality, events, gatherings, close contact businesses and gyms, places where the risk of transmission is higher. To continue doing work in these areas, workers will need to have their first vaccination by the day that the Covid-19 protection framework comes into effect, which is Friday, the 3rd of December. These workers will need to be fully vaccinated by the 17th of January 2022 to continue doing their work. This is to make sure that those workplaces are as safe as possible and to give confidence to both staff and customers. Already, the vast majority, over 91% of the eligible population, are vaccinated, with thousands more getting vaccinated every day. So we're well placed to move into the COVID protection framework. Today's announcements will further strengthen our safeguards. For those who are not yet vaccinated, especially workers in areas where My Vaccine passes may be used to operate, please get your first dose as soon as possible. Thank you very much and happy to take your questions.
What will the penalty be for businesses that don't enforce vaccine passes?
There are a range of penalties that are currently in the law and they will be increased in legal changes that we are bringing in shortly. The fines will increase to levels of $12,000 for a company or to $15,000 for a court-imposed fine for a company.
And when will they have to legally be checking those by? Like, is there any kind of grace period which gives them some time to figure it out?
No, when the new COVID protection framework comes into effect from the 3rd of December, it will be a requirement for My Vaccine passes to be shown for those businesses who opt into it, and it will be a requirement for all workers in those workplaces to comply and to be vaccinated by that date, to have their first dose by that date.
Why why is the assessment tool for businesses only becoming available in mid-December? Surely it's reasonable for businesses to want to have access to that before the traffic light system's implemented.
It's important to note that all businesses can currently use a health and safety risk assessment to determine whether vaccination should be done for certain kinds of work. So there is already a tool that businesses have available, and WorkSafe provide guidance on that. The vaccination tool we're announcing today is a simplified and clarified tool. The way it will be brought into effect is through a piece of secondary legislation that we create. We can only create that after the primary legislation has been passed, which we will be doing in the House this week. And we do need to make sure that we shape it up right and make sure that it's really strong and legally robust. So it'll just take a couple of weeks to do that. But it will be in place very shortly after the new COVID protection framework comes into effect.
And you said before that businesses...
For those businesses that don't go for the My Vaccine Pass, decide they'll stay shut during red and orange, but will their staff still have to be vaccinated?
Yes, it will be a requirement across all businesses who are in that category of the COVID protection framework that all staff do have to be vaccinated. It's important to remember that the reason that we've identified businesses in that category is that businesses and other organisations is that by definition the activities that they carry out are higher risk. So we want to make sure that we have the maximum possible level of protection for the staff who are working in those environments.
You said before that businesses that use the assessment tool correctly will have the legal backing, it'll be legally sound. But what happens to businesses that don't, and what checks are in place to ensure that people are using that tool properly?
Yeah. Under the changes that we will be introducing, businesses will be legally protected from the decision to utilise the tool. But they will still have to apply it in a way that's fair and reasonable and is consistent with their good faith obligations to the employees. So that'll mean things like communicating clearly and openly with the employees who might be affected, receiving their feedback and making decisions in a reasonable way. Cabinet's made the very clear decision that we would not take away the legal rights of employees to test those rights in the court if they think that they have been treated unfairly, and we think that's the right balance to strike. But I would send the message that this is a very simple tool to apply with strong and relatively objective measures which can effectively be checked off by a business or organisation who is using the tool. So businesses who use it and go through the process properly can have a very high degree of legal certainty. And that's a key point, because the key thing that we've heard from businesses and organisations to date is that they worry a bit about the legal position, that conducting a full health and safety risk assessment, if perhaps you're a small business, is quite a challenging undertaking. This will be a very simple tool to use, and as I say, as long as it's done reasonably, there'll be a very high degree of legal certainty.
Have you got a broad number of workers nationwide that will now be required to be vaccinated to go to work?
The broad estimate is that with the workers who are covered by the CVC requirements, in addition to those areas where there have already been orders put in place, health, education, border, we're at around about 40% of the total workforce. So that is a relatively significant portion of our workforce who will be covered by these vaccination requirements. I do note that internationally we now do have some countries who are pushing that out further. Austria with the all-of-population mandate, Northern Territory who require all work to be vaccinated. So we're trying to strike the right balance here, and we think that we've achieved that.
Are you still considering extending mandates to police and construction workers?
When Cabinet made its last set of decisions at the end of October, we set up two pieces of work. One was this piece of work, which was around establishing a clear and simple vaccination tool with strong legal backing. The other was to consider whether there should be additional vaccination mandates, including in those areas that you've mentioned, and we'll have further announcements to make on that part of it in the coming days.
And on the 40% number, do you have any sort of indication of how many people may choose not to be vaccinated and therefore lose their job?
We can draw some conclusions from areas where there have already been requirements that are put in place. So, for example, with the health and education orders that were put in place recently, at the first point, we've reached levels of around about 99% across both health and education in terms of workers who have been vaccinated. When we had the requirement applying to border workforces and at the air border and the maritime border several months ago, we got down to very small numbers by the time that the requirement kicked in. So while I couldn't give you a specific estimate today, because it just does depend on how people respond, our experience to date has been that the vast majority of people are open to being vaccinated and will do that, and that this can just be a little bit of a final push to make sure that people do make the decision. And let's just remember that as we stand here today, 91% of eligible New Zealanders have had their first dose. The vast majority of New Zealanders are on board and getting vaccinated, and actually those people are not going to be affected at all by these provisions.
This has been saying that
you've not quite, am I right, you've not quite finalised the vaccination assessment tool, is that right?
It will come into effect via a piece of secondary legislation, via a regulatory process.
Details haven't quite been ironed out.
That's right, and the fine details will be worked out through that process over the next couple of weeks, and then we expect that tool to be have full legal effect by about the middle of December. But what we have released today, and it's in the press release, is the tool itself, the 4 key criteria, 3 of which must be met before vaccination can be required. That will not change, and that's the key detail, really.
Not quite refined the tool itself. The legislation is going to be, all this is going to be covered in the legislation this week. I mean, is this not a bit last minute? Is there enough time for the legislation to be properly scrutinised?
Well, I've heard 2 things in there in respect of the tool. One is why is it not ready right now, and the other is isn't it sensible to have these things scrutinised and worked through carefully? And that's why, in respect of the tool, we are engaged. I'll just finish. We are engaging in consultation and engagement. So the tool's been developed by working with our social partners, with the CTU and Business New Zealand and other stakeholders, getting public health advice. We obviously can't move into establishing a piece of secondary legislation until after the primary legislation has passed, but we're talking about a couple of weeks at this point.
Right. Is it? I mean, are you scrambling here?
No.
And in terms of for unvaccinated people who want to engage with businesses over summer, right? Is it fair to say that basically, if it's an indoor business where there's contact less than a metre apart, and you're likely to be there for more than 15 minutes, you're not going to be able to be a customer of that business?
So the tool that we're talking about introducing today is a tool that will be utilised to determine requirements for workers rather than customers, and 3 of those 4 criteria will need to be met before that decision can be made. The 4th one being if the workers in that workplace serve people who might be in more vulnerable communities as well. So any 3 of those 4 can take place. It's also important to note that that's a tool that we're providing for employers to use. If they don't want to use that, if they want to conduct a fuller and wider health and safety risk assessment, because that works for them better, they'll still be able to use that process. So I wouldn't dictate what the outcomes might be for a particular kind of business. We'll let them work through the process.
There are a lot of businesses that don't fit the category of like hospitality or like private tutors or something like that. Where they are in close contact with someone, they're a customer, it's a business, and it's not necessarily explicit in the guidance. So I'm just trying to work out how those businesses would ascertain where they sit,
Well, under the tool, it will be a relatively simple exercise. You'll look at a particular area of work, the characteristics of that work. You can very easily assess on an objective basis the size of the area that they work in, the amount of time that they spend with other people, the proximity, and whether there are vulnerable people they interact with. So the tool will lead to relatively clear conclusions through quite a simple process. But as I say, if businesses want to do a deeper dive and assess a broader range of risk factors and mitigations and come to a conclusion based on that, then that option will be open to them as well.
You have been a little slow to react, Kevin, in the sense that, you're opening Auckland up, going to the traffic light system, everyone's going to supposedly rush off to have their great summer, and they'll be going to hospitality venues and others where staff won't have to be fully vaccinated until January the 17th, effectively when everyone's finished there.
I can clarify that point, Brent. For those businesses who are covered by the CVC requirements, the first dose for vaccination will be required by the 3rd of December when the framework kicks in. The second will then be required by the 17th. And obviously that's because we need to have a decent period of time between the first dose and second dose requirements.
Your circumstance, though, is it to be opening up with these requirements, and there hasn't been enough time to require the workers to get fully vaccinated?
I disagree with that assertion. We already have 91% of eligible New Zealanders who have had their first vaccination, and my own DHB, Auckland DHB, over 95% have. There have been months and months for people to get vaccinated. Between now and the point at which we move to the new traffic light system, there is further time for people to get vaccinated. It is plenty of time, and so I think that when we do shift to it, people can have confidence that we've got a system in place that requires vaccination and a higher level of protection. And let's remember as well that across those workplaces, within the CVC requirements, we don't expect that businesses and organisations just lean on vaccination. We expect other good practice to be in place to ensure that we keep people as safe as possible.
Primary industry groups like Horticulture New Zealand and the Meat Industry Association want the government to mandate the vaccine for them. Would you have any plans to do that, or would your message to those groups be use the tool and determine, yourself whether you can enforce a mandate on your staff?
Well, while we're not making announcements about any further mandates today, and that will come in the coming day, yes, I would say to businesses in that sector and other sectors that we have now got this tool which we are bringing in alongside existing health and safety risk assessment processes. And I do encourage businesses, whether it's as individual businesses or on a sector basis, to begin working to use these tools that are available. And let's just remember that across the spectrum here, we are trying to strike the right balance. We do believe that workplace mandates that are put in place by the government do have a place, but they are a very strong tool, and we have to assure ourselves that they are justified on health and safety and public interest grounds, considering the complex mix of individual and collective and employment rights that are at play. So every sector can't expect that the government will come in and just mandate and take away the need for any work and engagement in that sector. So I do also encourage businesses and sectors to get on with the job. So for example, I've had conversations over the past week with the Chief Executive of Waka Kotahi about work that can be done on a sector basis in horizontal construction to begin working through frameworks and making decisions there. And I think that's something that can be picked up alongside the mandates.
You said at the start there that there was going to be decisions on vaccine mandates or news on vaccine mandates in the coming day. Should we expect news on the police force or whatever today or tomorrow?
As I say, we will have further announcements on where we've gotten to in decision around mandates more broadly. I won't speculate about which particular areas, but certainly we've indicated that police were one of those areas that were being considered.
Just on that, why has it taken so long to reach a decision on the mandate for police? Ministers have been saying for like the last week that the decision will be coming soon. Same with the police commissioner. Why has it taken so long?
Every decision around workplace mandates does require very careful working through. As I said before, the decision to require a vaccination for a workforce deals with a complex range of rights issues. We do always want to make sure that we're consulting not only with the employers in that sector, but with those who represent workforces, including unions, and that whenever we get to a decision about workplace requirements through a mandate, that it is justified, that it is reasonable, that it is proportionate. So we do just take a little bit of time to work through those issues to make sure that we get to robust decisions, bearing in mind that we want any decisions that we make there to be able to stand up to legal challenge. We've done that so far, and we would want to make sure that the same applies to any future mandates.
Specifically, what was the issue with police, though?
Oh, there's no specific or unique issue there, but we have to go through a good process and make sure that it's a robust decision.
Were you concerned that there might be, a great enough, a lesser number of police on the front line with a vaccine mandate if it wasn't carefully brought into play?
Oh, well, look, with all of these things, we want to bring them into place carefully. But again, I'll just express a high level of confidence based not on theory, but based on the practice of bringing in place these requirements previously, that when we bring them in, when we work with the employers, when we work with the unions, we get a very, very high level of uptake, and actually we have relatively few people who don't meet the requirements. And I would not expect that to be any different with police or any of these other workforces.
Under this new risk assessment process, outside of people covered by the mandate, what kind of businesses and sectors do you anticipate that will go through this process and then end up having vaccines in place for their workers?
Look, while it will be up to individual employers and sectors to determine that, I'm hearing wide interest from businesses. So when I've been engaging with organisations like Business New Zealand, Retail New Zealand, other sector groups, all of them have been requesting that there is a simplified framework that is in place. So it would be my expectation that we have quite a high level of interest and uptake in the use of the vaccination tool. But as I say, there are also quite a number who in recent times have confirmed that Warehouse Group, for example, a very large employer in retail, that they're getting on and using their own health and safety risk assessment process. And again, I'll just repeat the comment I made earlier that I think there is some value where possible in there being a bit of a sector-led approach to this issue instead of just individual employers tackling it one by one. That'll help us get to a greater level of consistency.
Outside of retail, what other businesses have you heard from? Have you got examples of where this could be put in place?
Well, two sectors, for example, who have divided views in this area, the retail sector, the construction sector more broadly, have identified that they do want to make sure that they have a good level of assurance, that they want to make sure that the risk of transmission is reduced, because obviously if work sites have to close down, that has a significant economic impact. So I think potentially there is scope for the tool to be used in sectors like that.
Minister, why is this being, this legislation and other legislation around the traffic light system being introduced under urgency? I mean, there's been signalled for a long time. And do you think, next week is recess week as well, as only a few days, the House is sitting before then. Is there enough time really to give proper scrutiny to this legislation?
The most important thing is that we do have a full framework that's in place by the time that New Zealand transitions to the new COVID protection framework on the 3rd of December. So there is a need to move forward and to make sure that all of the systems are set up, that there's legal clarity about how the system will operate before that date. And you're right, we have a recess week next week, so that's why we do need to move forward with it this week. Look, I think it's fair to say that aspects of the COVID protection framework have been in the public domain for quite some time, are subject to pretty wide and open public debate, and also that we've been doing a lot of engagement with key stakeholders around these issues. So I've got a level of confidence that this is the appropriate way of giving certainty to people.
Is it also fair to say that in a more ideal world, legislation would go through the full process?
Look, we haven't lived in an ideal world over the last 2 years under COVID-19 is the truth. And we do sometimes, as a government, need to get on and put the structures and systems in place that keep people safe and give certainty. Within that, we will always try to have as much engagement as we possibly can, but we do also need to move forward and put these things in place. And look, I've spent most of the last 14 weeks in Auckland. People do want to see that we can clearly move forward. We've now provided that pathway from the 3rd of December, and the decisions we're announcing today, the legislation that will come forward into the House, will enable that to happen.
The idea that for some employees that haven't yet been vaccinated, the idea that they'll be required to, even if they ultimately do, will grate. It'll feel distinctly uncomfortable. Do you have any sympathy for them?
Yes, I do. These are not easy decisions to make. I've spent the best part of 20 years of my life working to support the rights of working people, working in the union movement. These are not decisions that we take lightly at all. But ultimately there's a play here around the rights that we have as individuals to make individual choices, which remain. People can still ultimately choose to get vaccinated or not. But the consequences of our decisions in this area affect other people. And that's why we believe it is justified and appropriate that we have these requirements in place. Ultimately, if a worker in one of these places where transmission is more likely makes themselves more likely to get COVID-19 by not getting vaccinated, they're more likely to infect their co-workers, they're more likely to affect customers, including children and people who cannot be vaccinated. So yes, we've got the rights of that individual to consider, but we've got the rights of the broader group of people around them as well. And we have to strike a balance.
How long is this sort of scenario going to last for? I mean, do you imagine that this framework won't be needed in 6 months' time, for instance?
At this point, the framework that I've announced today is will be a part of the underlying COVID-19 legislative framework that we have in place. So it will continue for as long as that broader framework remains in place. Currently, under the law, it expires in May of next year, and the government is looking to extend that, but it will not be indefinite.
The government's looking to extend that, so you can imagine maybe beyond winter next year we'll still be operating under the same system, but say in 2023, you could expect, I mean, it's looking pretty far ahead, but what I'm trying to say is this people out of a job for 6 months, or could it be longer?
Yeah, look, I'd be loath to put a specific date on it, and I know that that's what people would love to hear, but the nature of the COVID-19 global pandemic is that every politician who's ever stood at a podium and said this is how it will be in 3 months' time or 6 months' time or a year's time has been proven to be wrong. We need to make sure that we have a framework in place that keeps people safe, that has some flexibility built into it. We do know that COVID will be with us for some time. We've developed the traffic light system to be a flexible system that can take us through a reasonable period of time, but obviously we do want to get to a point where we can return to something that is more like full normality. All right, I'm getting a signal at the back there. Any last question? No? Okay, thanks very much everyone.